The next thing we need to talk about that affects a range of motion is something called accessory and physiological movements. And this sort of represents the relationship between bones within a joint. Again, this is introductory. We'll be going into this a bit more, but I'm just introducing it to you for this semester. So, accessory and physiological movements of joints. The accessory movements are those movements within a joint and surrounding tissue that allows for full range of motion, but cannot be performed actively in isolation. So we can perform actively in isolation when we ask a specific muscle to do a specific thing. So, in isolation, we can have one muscle do abduction, we can have another muscle do external rotation, and so forth. But this is something that occurs between the two bones in a joint that has to occur in order to achieve full range of motion, but can't be done in isolation as compared to everything else. When we look at these accessory movements of joints, this is known as arthrokinematics. So we're looking at arthrokinematics. Now, joint play are movements that are not under voluntary control, but necessary to achieve full pain-free range of motion. So we need the play between bones in the joint in order to allow full pain-free range of motion passively and actively. These cannot be created through active movement or contraction of muscles. So they can't be created in active movement, but they need to occur for active movement to occur. So they need to happen in order to have active movement move appropriately. When we are doing our work passively as a therapist, we can then have a look at this and see if it's functioning properly. Component movements are said to be involuntary obligatory joint motion that occurs outside the joint. And this accompanies active movements and are necessary for full pain-free range of motion. So we already have talked a little bit about this scapulohumeral rhythm or articulation. So when we look at shoulder abduction, adduction, we have rotation of the scapula that needs to occur in order to have the shoulder function properly. So we'll look here as a diagram that when we have the scapula here, so I'm going to draw a relatively quick scapula here, and we're going to have this sort of position here, and then we're going to draw the humerus here, sort of the head of the humerus fitting in there, like so. And when we look at, so this would sort of be the midline here, when we look at movements of abduction, for example, when we're looking this direction, the scapula has to be able to move along the thoracic cage in order for abduction to occur. So scapula can either rotate this way or rotate this way. So for abduction to occur, to have the humerus moving in this direction, we need this kind of rotation of the scapula to occur. If that scapula cannot rotate, then this is going to significantly diminish the range of motion of abduction that can occur between the humerus and the scapula. Okay? This is known as a component movement. And again, without that movement of the scapula, you're not going to get full range of motion. When we look at the movements of the joints and the muscles and this joint play, they're not mutually exclusive, but if you lose one, the other one can't work, okay? So when we're looking at these accessory movements, we have to consider a couple things that will happen between joints. The first is spin. Now, spin can be defined as rotation around a stationary axis. So for example, the steering wheel in your car, when you are turning your steering wheel to turn right or left, that steering wheel is spinning around a stationary axis, of course, which is the steering column. So that sort of represents spin, that there's rotation around the stationary axis. Roll is a bit different. I want you to think about a tabletop, and I want you to think about rolling a ball along the tabletop. New points on one articular surface meet new points on the opposing articular surface. So as the ball rolls along the tabletop, different surfaces of the ball are touching different surfaces of the table as the ball rolls along. The third is glide. So now we're going to think about that ball and the table, and we're going to grip the ball with our hand and we're going to slide it along the table. So we can say that glide is the same point on one articular surface encounters new points on opposing articular surface. So think of the ball on the table. You've grabbed the ball, and as you're sliding it along, the ball's surface is not changing, but you are encountering new points on the tabletop as you're moving or gliding the ball along the tabletop. So we can see here that when we're looking at this spin, roll, and glide, we can see here we've got roll happening here. So if we think of two bones in this articulation, this bone is rolling along on top of this one. So therefore, new points on this bone are touching new points on this bone. Whereas when we look at slide, we can see that the same point on this superior bone is meeting new points or different points on the bone on the bottom here, inferiorly, that's not moving. The last one, of course, is spin, and we can see that the top bone or superior bone is spinning around within on the bone itself around an axis. So when we look at glide, so what we have to remember here that we have here is our glide or slide that's happening here. We have a bit of a rule when we're looking at joints. So let's do another diagram here. So we're going to again take one bone here. I'm going to kind of come a little bit from the side. We have one bone here that is concave, and we're going to have another bone here that is convex. Okay, so we can see here we have a concavity and we have a convexity between these two. So there is a rule when we look at differing bone movement. This is known as the rule of convexity and concavity. If a moving surface is concave, the glide occurs in the same direction as bone movement. So we can see here, we've got our concavity. What we're saying is that if this bone here, we'll call this bone 1, and we'll call this bone 2. We can say that bone 2, when it moves, because it's concave, if we move this bone superior this way, the concavity will also move superiorly the convexity will move the same direction as the concavity. Oh my goodness, sorry gang. The concavity will move in the same direction as the convexity. I'll repeat. If we're going to have the bone move in this direction and it is concave, the concavity will move in the same direction as the bone in relationship to the convexity. So whether the bone is moving this way, this will move this way. And if we move this way, of course the bone will move that way because it's concave. Now, if the bone that moves is convex, glide occurs in the opposite direction of bone movement. So if we look at this diagram, if we are going to move this bone in this direction, the convexity is going to move opposite ways in this direction. So we can see here that the bone is moving this upwards in this way, and that because it's convex, the glide is moving downward. So the bone is moving up and the glide is moving down. Same thing here. If this bone moves downward, bone 1, then the movement of the convexity will be the opposite, moving this way. So as the bone moves down, the end of the bone that's convex will move up. If the bone moves up, the end of the bone that's convex will move down. I do have a video here. Let me help a bit with this. It's going to take just a couple of moments, but that's okay. Hopefully you'll be able to hear it. Okay, so hopefully that helped a bit. Now, I did have some stuff on there in regards to joint mobilizations, which is something you don't know yet, and it will not be something you'll be taking for a couple semesters, but I'm just showing you that because of application as to why it works. What you need to know for the purposes of examination is this rule of convexity on concavity. Again, if I go back to the diagram here, the concave bone glides in the same direction as the movement, and the convex bone, the glide moves in the opposite direction of it. So maybe I'll just put it this way so that on the recording you'll remember it. So this will be A, and this one is A, and then we've got B here, and we've got B here, and of course in the concave one, this will be A, and this will be A, and of course then this will be B, and this bottom one will be B. Okay? And hopefully you'll remember it that way. I hope that video helped to some degree. Examples here, as I said, the glenohumeral joint. We look at the concave glenoid fossa of the scapula, and the head of the humerus is convex. Abduction of the humerus, so moving the humerus away, is inferior glide. And the question I have is why? Well, that the inferior glide is in the humerus at the shoulder. Abduction has the arm moving superiorly, and of course because the bone that's moving is convex, as the humerus of the arm moves upwards, the glide will go inferiorly. Adduction is a superior glide. Again, the idea being that as the arm gets closer to the body, going down, then the glide, of course, because it's convex, would be the opposite, would be superior glide. And we just did the knee here in the video, and you can understand that, but certainly answer these questions for yourself. That's the end of the